All right, so let's take a look at these new results that are showing a significant reduction in chronic low back pain after 3 months of treatment using transcutaneous auricular vagus nerve stimulation, or TAVNS. This is without any medications or any invasive procedures. It's using a stimulation device that's placed in the ear. So let's go through this paper and see if it's identifying a new and easy treatment for chronic low back pain. Um, by the way, I'm Dr. Jared Younger. I'm director of the Inflammation, Pain, and Fatigue Laboratory. So let's start with the basics. Low back pain is the most common chronic pain condition. In many cases, if someone has low back pain, they have a definitive structural or other issue. It could be osteoarthritis, it could be an injury, could be posture problems, could be autoimmune disorder, could be degenerative disc disorder. But in other cases, a lot of other cases, there's no obvious clear pathology in the back. And the long-term pain is caused by central sensitization or dysfunction of the pain system. So regardless of the specific original cause, chronic low back pain is very debilitating because of course, if your back doesn't work, it adversely affects everything that you do. So this French group, medical research group, ran a small study to see whether transcutaneous auricular VNS can reduce back pain. So let's break down what that is. So first of all, transcutaneous means it's through the skin. Auricular means it's at the ear. And vagus nerve stimulation uses electrical pulses to activate the vagus nerve, which has positive effects on autonomic balance, like sympathetic versus parasympathetic balance, has effects on inflammation in the body and in the brain. And so it's used for pain, it's used for anxiety, and many other conditions. I've always been interested in using vagus nerve treatment in chronic pain and chronic fatigue, but I've always held off on using it because of the invasive nature of classic VNS that requires you to cut through the skin. You have to place an electrode around the vagus, and you have to link it to an external stimulator and battery pack. Now there's evidence that you can get similar benefits without the invasive electrode placement by stimulating the auricular branch of the vagus. And in that case, it's close enough to manipulate through the skin, so you don't have to implant anything. And that makes it much more interesting to me. It's safer, it's more tolerable, it's easier to set up, and there's fewer complications. But the question is does it actually work? So let's take a look at the paper and see. So here's the paper. The title is Effect of Transcutaneous Auricular Vagus Nerve Stimulation in Chronic Low Back Pain, a Pilot Study. Now, this is an open access paper, so you can download the full report at the link that I put in the description. And this is a clinical trial, meaning it's testing a possible treatment in humans. It's also classified as a pilot study. So that means it has a small number of participants, in this case, 30 people. So it's not going to give the definitive answer. You have to run much larger studies to do that. This is also an open label study, which means there's no placebo or sham control condition. So all the participants knew that they were getting the real treatment. That means if we see a benefit, we don't know for sure how much of that is due to the placebo effect and expectancy versus the actual vagus nerve stimulation. So it's important for me to note that I cannot conclusively determine the true benefit of this treatment approach. We have to have a placebo-controlled trial to do that. All right, so the group of participants, these individuals were between 18 and 70 years old. These are people who did not respond to conventional treatments, and they had to have at least 40 out of 100 low back pain, with 100 being the maximal pain. So 40 is kind of low moderate was a requirement. They had to have low back pain for at least 3 months. Most of the participants, though, had pain for many, many years. The device they used is called the Vagus Stim device. This is made in France, and they coupled it with an ear stimulation electrode. I did check online pretty quickly, and it does seem to be available. I did not look into it. I didn't try to purchase one. I've never used this device. It looked like it was around $400, but I'm not an expert at home devices, and so I cannot personally vouch for this device or any other at home vagus nerve stimulator. So please talk to your doctor before you try it. You have to make sure that you don't have exclusionary heart arrhythmias. You have to make sure that you use it properly. You should use the left ear instead of the right, and there's important reasons with heart rhythms to do that. You have to make sure you use the conductive gel properly, and there's other aspects that you have to get right, or it's not going to work, or it's going to cause problems. So again, I can't recommend anyone just go out right now and try this themselves. I'm just trying to show you what is being looked at now in the cutting edge research. I'm not telling you things that are already fully tested and ready for widespread use. There are other channels and other sources to get that information. So in this protocol, people used this auricular device for 30 minutes per day, and they did it for 3 months. You can read the paper for all the specific settings. There's particulars in the waveform, the frequency, the pulse width, and the amplitude or the power of the stimulation. And there's a process for determining the proper strength or amplitude so it doesn't cause discomfort. Now, I'm only going to look at the one outcome, the main outcome, which is pain 0 to 100, and we want to see if it reduces the low back pain self-reported. They did look at a lot of other outcomes, but for the interest of time, I'm only going to look at the pain. Again, you can look at the paper to see the other outcomes. So out of the 30 people, I think they lost 4 people for various reasons that weren't related to the study. There was one case where a person had side effects that could be attributed to the device. That one person had or reported blood pressure spikes and palpitation problems after they started using the device. It is possible the device caused the blood pressure issues and palpitations. It is also possible that the person had an anxiety panic reaction to using the device, and that would also cause a rise in blood pressure and could induce the arrhythmias. So we're not sure, but it's something to keep in mind that is possible that the device is going to cause issues with blood pressure and arrhythmias, though that is much less likely to happen if you're using, again, the left ear instead of the right ear. So I don't know for sure that there are any treatment-induced arrhythmias in this study, but it's possible. So we have to note that. So anyway, let's look at the main results. Baseline pain was around 63, which is kind of a high, moderate level of back pain. It's definitely a level that it's going to interfere with quality of life. We can see at about 1 week, it dropped closer to 50. So a nice little initial reduction in pain. Then it dropped to right at about 50 at 2 weeks. It stayed there, it looks like, at 3 weeks. And then at 1 month, it dropped to 47. And then it looks like it drops down to about 39 at 3 months. Now, there's some complexities because a few people received other treatments in the middle of the study, and so they had to do some statistical adjustments to account for that. They wanted to make sure that wasn't conflating the results or confusing the results. But basically, to put it simply, it looks like there was about a 37% reduction of pain at 3 months. Now, 37% reduction is pretty good. That's definitely a clinically significant response. Patients will perceive 37% reduction as a noticeable improvement. And also note that 37% reduction is the average response. We can see right here that there's considerable variability. Some people responded extremely well with pain near 0, and others did not respond very well. So what do I think? First, everything looks reasonable in this study. I don't see any obvious red flags. The pain response looks legitimate. It looks in line with things we've seen in other populations and other pain conditions. It's not suspiciously large, I guess is what I'm saying. I always get suspicious if someone tries a treatment and all the participants have their pain go down to 0. That's just not reasonable. So this looks reasonable to me. The authors report no conflicts of interest. The only thing that some people might consider a conflict, though it's not really, and certainly not a strong one, the company that makes the stimulation device provided the device for free to the research group, but the company was not otherwise involved in the study or the analysis of the write-up. And there's really nothing wrong with that. I think if I was interested in running a study and it was an expensive device, I might go to the company and say, hey, I want to run a study. Could you give me a few of these devices for free? And I wouldn't necessarily consider that a conflict. So those are the pros. On the negative side, this is a pilot study. As I said, it's too premature for me to recommend. The main issue, of course, is the lack of the placebo or sham group. And that's easily fixed with the larger randomized control trial. I'm going to assume that this research group is now pursuing a larger trial now that they have interesting pilot results. I would love to see more clinical trials with VA-TNS because I really like the ease of the approach, because it's non-invasive. I have to note I'm skeptical that VA-TNS will work as well as the classic implanted route. In classic, you're directly stimulating the vagus, whereas with VA-TNS, you're only stimulating a branch of the vagus. So you're kind of indirectly affecting the vagus nerve. Also, of course, when you implant, you're touching the nerve itself, and so the effects are going to be stronger. It's touching or it's wrapped around the vagus, as opposed to just trying to transmit that energy information through the skin. So I expect classic implanted to be more powerful than this newer transcutaneous auricular approach. But that assessment is just based on common sense. That's not actually based on scientific data. I would love to see really good comparisons between the classic and the transcutaneous approach to see how much they differ. In any case, it's nice to have two options. Certainly, for a long time, clinicians have been using the classic approach, so that's still available. But now there's something for someone who's not willing to do that. You may get some of that benefit without having to go through that procedure using this home device. So as you're trying to balance efficacy and tolerability and safety and cost and other factors, it's good to have these options. By the way, I'm working on a new VA-TNS project as well. It's not for low back pain. It's going to be more for issues like myalgic encephalomyelitis, chronic fatigue syndrome, or ME/CFS. I'll talk about that project later. Again, I have to say this one more time. Remember, there are important settings to use, and this approach can be harmful if you do it incorrectly. So again, I can't vouch for devices and I can't recommend that you try it yet. Maybe there are other experts that can do that. I'll leave that to them. Also, make sure if your back pain is relatively new, just a few months old, it's hit that 3-month mark, make sure that you try to investigate the cause of the back pain with your medical professionals, because you don't want to ignore something with an addressable core cause by going straight to TNS, because I'm sorry, VNS, not TNS, but vagus nerve stimulation is unlikely to fix the back problem. It's more to boost your pain systems and help your analgesia. So don't ignore the the original cause of the back pain. This is more to just help you cope with that back issue. It could reduce the inflammation that might ultimately speed up recovery, but there would have to be more research to show if that's a case. So be sure to talk to your physician right now. And that's really it. It's interesting to me. It makes sense. It fits in with what we know with the more classic stimulation method of VNS manipulation. So yeah, it looks good. I'm glad they did it, and it's definitely something to consider. So I hope that's helpful. Take a look at the paper if you're interested, and you'll get a lot more information because I didn't cover most of the stuff in the paper. Just want to kind of introduce it. So I hope that's helpful, and I will be back next week with more research. I'll see you soon.